Hipospadias is originally a Greek word. Hypo means below, spadias means opening. This means that the opening where the boy passes urine is not on the tip of the penis, but on the undersurface. We classify it into 4 grades, depending where the opening is. If the opening is here, this is grade 1. Near the head of the penis, grade 2. Near the scrotum, grade 3. Between the testes is grade 4. Luckily, in 98% of children with hypospadias, we diagnose it at birth. Why? Because boys are usually born with complete foreskin. When the foreskin is not complete, this is an indication of hypospadias. The remaining 2% we usually find out later when they start to put the foreskin back and they realize that the opening is not on the tip of the penis. The symptoms of hypospadias is the child does not pass urine from the tip of the penis and that the foreskin is not complete around the penis. In majority of cases, they don't have difficulty to pass urine, but in about 10-15%, the opening for the urine to pass out is small, and then he has difficulty to pass urine, and this may cause back pressure on the bladder and the kidney. The important point is to try to correct hypospadias during the first 18 months after birth. This is very important for several factors. Number 1, if the penis is curved, it's much easier to correct it when the baby is small, before the body of the penis is actually affected. Number 2, there are several studies that show that after 18 months, the child can remember what happened, and this may affect him psychologically later on. Number 3, the younger the child, the better the healing, the less complications. Patients or babies with grade 3 or 4 may have associated problems with the bladder and kidney. They may not have both testes in the scrotum. All these points are very important and should be put into consideration before we make an appointment of surgery. We do the routine blood test and urine analysis, but more than that, we do, and probably ultrasound on the kidneys to make sure that everything is okay. Only in grade 4, where the testes may not be in the scrotum, we need to do some chromosomal analysis and genetic tests to make sure that he's a normal boy and not something mixed or some mixed gonads or something. There are more than 300 operations already described for the correction of hypospadias. This is a clear indication that there is not a single technique that is suitable for all patients. And surgeons always try to improve their techniques. The problem that we really face that there is a technique that was described about 15 years ago, which is easy to do, and many surgeons are doing it because it is easy. But unfortunately, the complication rate of this technique are very high, and we as hypospadias specialists are confronted to correct these complications with difficulty after this simple technique. I developed techniques for the different grades of hypospadias, and the complications rate is low because we make really healthy wide urethra that will grow with the child and not start to have complications. Healing takes about 1 month until it is complete with 70%. And takes six months to be completely healed. After 1 month, he can lead a completely normal life. If we use these easy surgical techniques that are unfortunately popular, they have a lot of complications, and the child may need regular dilatation, or what the surgeon may call calibration, which is very painful for the child and for his family. So it's very important to go to a hypospadias specialist who does perform a lot of hypospadias operations, at least 50 operations per year, and has good results. Why it is very important to correct hypospadias? We can divide it into functional, cosmetic, and psychological. Functional, if we don't correct hypospadias, the boy will not be able to stand to make a pee, and he has to sit like his sister or mother. And this may be very embarrassing at school. Another function is when the baby or the boy grow up and becomes a man, and he would like to perform with his wife or girlfriend. If the penis is curved, he will not be able to function. Even if it is straight but the opening is not in the right place, he may not be able to have children. So that's very important. And the third point, that is cosmetic. Everybody nowadays is aware what a normal penis looks like. And even if the partner or wife, doesn't matter how the penis looks like, the self-image and satisfaction with the body is very important. I have children, for example, from Greece, who had been operated on 40 times before he came to me. He was on antibiotics 6 months every year, and after I could help him, he became the top in his class. He became top in sport. So it's very important for every boy image that he be satisfied with his body.